This video is a demonstration of an arthroscopic double row rotator cuff repair. This is the shoulder of a 57-year-old female with shoulder pain. Here you see the smooth white cartilage of the humeral head and glenoid. Surrounding the glenoid, we can see here the labrum, which has a wear pattern typically seen with age, but no discrete tear. In this location in the shoulder, we are currently underneath the rotator cuff. As we look up, we can see tearing within the substance of the supraspinatus tendon of the rotator cuff, as well as its complete tear off the bone, called the footprint. Now we are above the rotator cuff and the full thickness tear of the supraspinatus tendon is clearly evident. A shaving device is then used to clear the bone of any debris in preparation for repair. Next, a drill guide is used to place 2 anchors at the level of the articular margin next to the cartilage of the ball. Each of these anchors has 4 limbs of thick suture that will be used to fix the tear. These anchors are inserted into the bone, expand once in the bone, and hold very securely. These are placed at the front and back of the tear, as this will help to restore the normal anatomy of the tendon after the repair. Next, the goal is to pass each limb of the suture through the healthy portion of the tendon and spread them evenly to cover the entirety of the tear. This is achieved with a scorpion passing device. Each stitch is loaded individually and passed through the full thickness of the tendon. Again, this is done with all 8 stitches spread evenly over the tear. Next, the corresponding limbs of each sutures are tied to each other with a sliding knot technique. These 4 knots will push the rotator cuff back down to the bone where the anchors are, creating a strong medial row of the repair. Following this, we then complete the lateral row of the double row repair by further securing the limbs of these stitches through 2 non-metal screws. This adds to increase the strength of the repair as well as to ensure a full anatomic restoration of the entire tear. In this patient, we use a thicker form of suture, which will increase the pull-out strength, thus providing a stronger repair. Here is the bird's eye view of the secure anatomic double row repair of the rotator cuff tear.